Thank you guys for joining us today. We have Dr. Obie with us. Dr. Obie's going to talk about the endocannabinoid system, the medical cannabis here in Texas, and how that affects you. And so we appreciate your time, Dr. Obie, for joining us today. You have a beautiful backdrop, and take it away.
Okay, thank you guys so much for having me. My name is Dr. Obie, but most people call me Dr. Olga. And today I'm just going to talk to you guys about the basics of cannabis, very basics of cannabis, and why it is pertinent or relatable to us as human beings. Let's get started. So first, I always like to tell anyone that I'm talking to, whether it's a patient, friend, or stranger that has a question, I want to tell them a little bit about myself so that they can have an idea of why what I'm saying is validated. And so, and I tell all of my patients, this is what you should do when you meet your doctor or your practitioner for the first time. Find out who they are, just like if you were to put your child's life in someone's hands, you want to know that they were capable. So who am I? As I mentioned, my name is Dr. Olga. My background starts from Houston, Texas. I went to the University of Houston and got a bachelor's in sciences in both biochemical and biophysical sciences. Then I went on to get my medical doctorate at the University of Texas Medical Branch, which is in Galveston, not too far from Houston. After that, I decided that I wanted to go into emergency medicine and took a residency at the University of Alabama in Birmingham and spent 3 years there, including my last year as a chief resident. And then finally, I went on to further my expertise in emergency medicine by getting board certification, which says that I'm specialized in my field, which is emergency medicine. So for everybody that knows me, I'm Dr. Olga, and I'm board certified in emergency medicine in the United States of America. After I finished residency is when I hit a roadblock. And what I realized was that we had really been taught throughout medical school and residency to treat medical conditions, which doesn't necessarily mean the same thing as curing. And so I realized that what I really wanted was to heal people rather than just to treat them. And so because of that, I realized I needed to learn more. And I went on, after residency, back to a country called Peru. I also traveled to other areas of the United States to kind of give me an idea of how I can incorporate healing into my regular medical practice. And as I mentioned, I went to Peru. When I came back, I realized I didn't know enough. I had been introduced to naturopathic or holistic or native medicine, which is all like herbal-based medicine, really meant to heal, but I didn't know enough. So I started traveling more and studying more, and I visited several countries, and I read texts from several cultural backgrounds, specifically like the Eastern Asian cultures and the Southeast Asian cultures and the South American cultures. And eventually I came back and I created an educational platform called Refined Pharmaceuticals, which was meant to teach patients faster than I had learned in a way that was easy to understand. And so we created this company based around educating the general public about health and healing medicine. I later on went on to join several companies as medical director, including James Henry, which is a cannabis company in California. And then I also went on to pursue my second board eligibility in lifestyle medicine, which I'll be board certified in November of this year. And then finally, I went on to become a registered state of Texas compassionate use program physician who was allowed to prescribe or to recommend and prescribe medical cannabis in the state of Texas to medical patients in Texas. Okay, so after I started to expand my involvement, I started to expand my understanding, and I joined several companies. I started to feel very comfortable with medical marijuana. And I specifically call it marijuana because it is the most known word to represent cannabis. So now let's focus. What exactly is cannabis? And it is important that we start here so that you can understand how you can treat or heal yourself with the consultation or expertise of a medical practitioner. So first we start with hemp and marijuana. Both hemp and marijuana contain THC. Now you can see on the left-hand side that hemp contains significantly less THC percentage than marijuana, but they both contain THC. Both also contain CBD, and as I mentioned, they both also contain THC. Now both plants are part of the same family. They also contain multiple other constituents like cannabinoids, terpenes, and flavonoids. In other words, hemp and marijuana are not really that different. And so I choose to call them both marijuana because they are the same plant. The reason why they work, though, is because of a specialized system that we have called the endocannabinoid system. The endocannabinoid system is called just that because it shares cannabinoids with the plant cannabinoid system, or it shares similar actions and properties. And it shares it so similarly that it seems that our entire system jives almost perfectly with this plant. And as a physician that has studied many other herbs, I have not come across a single plant, also known as an herb, that is so synonymous to our own system. And so because of that, that leads us to discover more about our system so we can really understand how to utilize this plant. Again, our system is called the endocannabinoid system, or the ECS. So just remember that, ECS. And it is responsible for something called homeostasis. And I really want you guys to hone in on this word. Homeostasis literally means balance. It is our biological balancing system. What that means is that every other system cooperates or is coordinated by this specific system. So your brain, your heart, your reproductive organs, your skin, even your emotions are all trafficked or governed by this system, which just so happens to be synonymous to the plant cannabis system. And as I mentioned, it is responsible for keeping our body in balance. Anything that is not in balance is tending towards chaos. And for human beings, what that means is disease, death, and disability. When all of these systems are in line and balance, then you are disease-free, disability-free, and living. This is a groundbreaking discovery, our endocannabinoid system. So usually this is the part where my patients say, okay, Dr. Olga, tell me more, I'm on board, tell me more. So we're gonna dive deeper into our ECS. The ECS is made of three major components. The first one we're gonna talk about is cell receptors. Think of cell receptors as a cup or a catching place. Major receptors in our endocannabinoid system are CB1 and CB2 receptors. The next component, endocannabinoids. This is where the fun begins. Endocannabinoids are the substances on its CB2 receptors. Our major endocannabinoids are anandamide, which attaches primarily to the CB1 receptor, and 2AG, which attaches primarily to the CB2 receptor. The next and third most important or major component of the endocannabinoid system are enzymes. And you can think of enzymes like scissors. The major enzymes in our endocannabinoid system that we're going to talk about today are FAAH, which cuts anandamide, and MAGL, which cuts 2AG. Now, side note, it's important to cut down substances so that you can recycle them. That's how the human body stays efficient. Instead of destroying things and throwing them out, it recycles a great majority of our substances so we can use them again. When this system is working perfectly, it's responsible for water balance, body temperature, neurological function, which is our brain, our movement, our behaviors and activities, balance, blood flow, immune system responses, heart rate. I mean, if you look at all of these actions or functions, you can see this is basically our entire body. Okay, so let's hone in a little bit more. CB1 receptors are found primarily in our central nervous system and in our spinal column primarily. And when it is working properly, it is responsible for our neuropsychological functions and preventing neurodegeneration or breakdown of our nervous system. CB2 receptors are found in other organs, which we call the periphery. So like our tonsils, inside of our chest, in our bone marrow, in our lymphatic system, and in our spleen, among other places. And when it is affected, it is responsible for the creation or the prevention of autoimmune diseases, allergies and asthma, inflammation, which is pain, vaccines. So think about COVID or flu vaccines or any of our other vaccines. Immune boosting properties, it controls infections and all kinds of things in our peripheral system.
Hey, Dr. Obie.
Yes.
The wind is kind of rough there. Didn't know if that was something we could adjust.
Let me see if I can. Does that change anything?
Yeah, so far so good. Yes.
Okay. All
Thank
right.
you so much.
I'm gonna try to talk louder too. Okay, so overall, we have 6 major ECS enzymes for anandamide and 2-AG alone. So that tells us that our endocannabinoid system has been extensively researched already. Even though marijuana is just becoming legal in states in the last 15 years or so, this system has been studied for much longer. And so this is how we know all of this information. There are 5 other known endocannabinoids besides anandamide and 2-AG. There are 4 other known ECS receptors, and you can see them here. There are 3 other endocannabinoid-like compounds besides 2-AG and anandamide, which tells us how extensively the system reaches in our bodies. And I know it's also complex. So now we're going to come down to, what do our endocannabinoids do? What do they do in our body naturally? We're going to start with our cell receptors, CB1 and CB2. And this is anandamide. And you notice it has like a triangulated shape at the bottom. That is just for visual. But this is how essentially these substances are able to attach to receptors, is because of their shape. Anandamide, like we said, binds to CB1 receptor. And as a result, it is responsible for our perceptions of pain, our memory, our mood, our appetite, our cognition, which is how we think and act out thoughts, and our emotions, which are the thoughts themselves or the feelings that we get from our thoughts. And then the CB2 receptor, generally 2-AG binds here, but it also binds to the CB1 receptor in a slightly different position so that the shape matches. And as a result, it can have effects that you would see with both CB1 and CB2 receptors, like effects on our bone health, reproductive organs, again, our memory, our immune system, again, pain, and all kinds of other functions that we see with CB1 receptors as well as CB2 receptors. So where does cannabis come in? Now we're talking about the plant. When we say cannabis, marijuana, hemp, we're talking about the plant. When we say endocannabinoids, we're talking about our bodies. So cannabis comes in with 3 major components. Its components are flavonoids, terpenes, and of course the cannabinoids, which we talked about, that are CBD and THC and the like. So flavonoids are responsible for the plant's color. And this is all plants. This is not just cannabis. So for example, the color green has a therapeutic effect in cannabis. That's what we call chlorophyll, for example. Terpenes, which are responsible for a plant, including cannabis's smell. For example, peppermint has a minty smell. We also know that mint has a therapeutic effect. Well, the smells, which are terpenes in cannabis, also have therapeutic effects, such as myrcene, which is a well-known terpene that helps with pain relief. Okay, so now those are the major components of cannabis plants. Now we're going to come back to our bodies and see how visually the cannabis plant affects our receptors in our endocannabinoid system. So we take anandamide, and you notice that it purposely has a similar base shape as THC. THC also is known to bind primarily to CB1 receptors, much like anandamide does. Now you notice that anandamide, you can see THC has a little space in between itself and the CB1 receptor. Notice how anandamide binds a little bit differently. That is the major difference between plant cannabinoids like THC and CBD and endocannabinoids or human cannabinoids like anandamide or 2-AG. Anandamide and 2-AG are the natural binders of our receptors. THC and CBD and the other plant cannabinoids are other similar natural binders, but they're not exactly the same. Okay, CBD is thought to primarily affect our enzymes. In this case, CBD is thought to augment or to change or inhibit the FAAH enzyme, and that would prevent anandamide from being cut down. And you would see increases in anandamide inside of the body. This is why CBD does not give that intoxicating effect, because it naturally increases anandamide, which does not cause intoxication. Whereas THC directly binds, CBD indirectly causes an increase in a natural relaxant. Okay. Another way that CBD is thought to affect our endocannabinoid system is by changing the shape of the CB1 receptor. So you can see on the left, THC would bind normally to the CB1 receptor, just almost perfectly. On the right, you can see CBD affecting the receptor on some other part of the receptor. And as a result, that landing pad that THC would have gone into is skinnier. This is how CBD is thought to be helpful if, let's say, you over-medicate with THC. When you take CBD, it decreases the effects of THC, and this is one of the proposed reasons why, that it changes the shape of the receptor and does not let THC have a direct effect. Okay. There's also many other plant cannabinoids, which is beneficial for us because they all affect us in positive or functional ways. And so I put this here deliberately so that everyone can see. I mean, we have at least 10 other plant cannabinoids that have been discovered, all of which that affect our endocannabinoid system. And it's not a coincidence. There's one that's becoming very popular, and that's CBG. And you can see why. It affects blood pressure reading, so it can control your blood pressure without blood pressure medications. It's also a muscle relaxant, a mood stabilizer. It helps with sleep for insomniacs, promotes bone growth, and can be used as an antibacterial and antifungal. So this is just a list of other plant cannabinoids and how they affect us. Now I'm going to breeze through the rest of this because this is about really about the Texas Compassionate Use Program and how you can get your hands on medical marijuana in the state of Texas or CBD. So basically, if everyone does not know, I want to make sure that we understand that still marijuana or marijuana are considered Schedule I drugs and are therefore illegal in the United States. They are only made legal independently by the states. You can see that marijuana is listed here along with LSD, heroin, and some other psychedelics. Now, the other drugs that are legal are Schedule II and higher, so Schedule II to Schedule V. Marijuana, as I mentioned, is Schedule I. Luckily for us, hemp has been descheduled, and so it is obtainable in any state as long as it is less than a certain percentage, which I'll talk about in a second. So, what is legal is industrial hemp. That is legal across the country. As I mentioned, it has to contain less than 0.3% of the total weight of THC. Medical CBD is legal in the state of Texas. It has to be a low content THC or less than 0.5%. And it can only be obtained by registration and authorization by a medical doctor. Okay, this is just talking about where you can find that information. The Texas Compassionate Use Program made low THC cannabis legal in the state of Texas with a prescription from a physician that's certified. And as of 2019, more qualifying conditions were added, including all of the ones that are listed on this board. What that means is that if you have any conditions that are listed on this board, you do qualify to obtain a medical marijuana prescription from a licensed physician. And the way that that takes place is through the Compassionate Users Registry of Texas. And the step-by-step, I'm going to go through a little slower. Let me put them all up here on the board. You first have to find a physician that is registered. Still, the best way that I have been able to let patients know about this is through the CURT website. On this link here, if you follow it, then it'll give you a list of providers that are supposed to be able to register you. Then you make your appointment. After your appointment, if you qualify, your physician will physically input your information into the system. After that, it becomes electronically available to the dispensaries that are registered with the state. So then you can call them, match your prescription with what they have available, and then they can either deliver it to you or you can pick it up if it is a dispensary where you're allowed to pick it up. And it's a very simple process. And in fact, your physician doesn't even have to be registered initially. You can actually walk them through the process of registering you after you have clarified with them if they recommend for you to take medical marijuana. Then during that visit or another visit, you can walk them through the registration and they can register usually within a few days. So it doesn't necessarily have to be someone on the list. Everyone needs to know this. The cost for the entire process I'm listing on this next slide. It is important to know so that you can understand, even if you find, let's say, the formulation that will work for you, even if you find a physician that will work for you, you still have to make sure that you understand you have to be able to afford it. You can expect most of your initial visits with a doctor will either cost between $75 and $450 per visit. Visits are every 3 months generally because we're registering patients for controlled substances. Some TCUP providers may accept insurance for the visit alone, so make sure that you inquire about that. Medication, and I'll show you on the next slide, can cost anywhere between $75 and $342 per bottle, depending on what you need. And your supply duration, or how long or how frequently you need to refill, depends on how much you're using and how often you use it. So this slide is really kind of breaking down what I was able to discover is available in the state of Texas. You can see compassionate cultivation on the left. In the middle is Certera. And as far as I understand, I think Fluid is now ready to take orders by phone for delivery. And you can see the breakdown of the different costs for different tinctures. For example, I have a patient that takes a 1-to-1 for her MS and for her spasticity. So on the left side column, you can see her tincture would be the 1-to-1. It's 1:1. Her bottle generally costs about $75, but she takes about 150 milligrams per day. And you can see that inside of the bottle is a total of 300 milligrams of CBD and THC combined. Her dose is 150 milligrams of the combined amount. So she would go through 2 bottles one bottle every other day. And so multiply that by 15. So you would multiply that 75 by 15, and that's how much she would have to pay out of pocket in order to get her medication. And so it's important, and I also want you to understand that that's a very high dose. Not everyone will have to take nearly that much, but this is to give you a perspective of how much you can expect you might have to pay per month for your medications. Pediatric patients and parents of pediatric patients, really, I want you to understand or know that there may be some medical assistance programs for you or your child's medication. And also remember, travel safe. Most people want to visit outside of the state of Texas with their medications. Understand that it is not legal to fly with these medicines outside of the state of Texas. What I've had some patients do is put their medication in their check bag and leave their medical marijuana prescription printed inside of their medication bag. Again, it's not legal, but I know that some patients have been able to do that without any issues. And finally, if you don't qualify for medical marijuana as a prescription, you can still utilize industrial hemp. This is going to require a lot more coordination between you and your medical professional because there's so many different options on the market and not all of them are reliable. But you can still utilize that if you don't qualify for the medical marijuana program. So you want to ask about ingredients, always ask for certificates of analysis, find your dose either by using a medical professional or finding a dosing calculator, and of course, consult with a healthcare practitioner. When you finally find the formulation that you're comfortable with using, always start low. For me, start low means literally 1 or 2 drops that you're increasing every 1 to 2 hours until you find your effect. And then once you find your effect, you stop at that dose. So some people that's 5 drops, some people that's 10 drops, some people that's 2 dropper fulls. But you're going to start low, quite literally, and then increase. And that's pretty much all I have for you guys today. If there's any questions or comments, I welcome them now.
All right, Dr. Obie, thank you so much. That was awesome. Happy that you were able to do that, and we appreciate you today. So we do have a couple questions that we will get started here. The first question that we have is, someone was asking in terms of dosage, your experience with strain, compassionate cultivation is not strain specific, but they were just asking, and which strain of plant is better, I guess, in a sense.
That is an excellent question, and it's one that we in the medical cannabis community are trying to kind of slowly increase the understanding. So to speak to the rest of the audience, when this question comes up, the question of strain has to do with traditionally with these kind of name brands, I guess, like Purple, OG Kush, or Purple Haze. And generally, when you're talking about strains, you're talking about strands. So indica, sativa, or hybrid. What we're learning now is that when we're talking about an indica, for example, we're actually talking about the percentage and the makeup of terpenes and cannabinoids. And so, for example, an indica dominant strain would have a higher content traditionally of THC, but what we're learning is that it also has a higher content or different genetic makeup of terpenes. So perhaps more myrcene, beta-caryophyllene. And so I want to make sure that I want to really stress that as you become more well-versed in your cannabis experiences, try to pay attention to the actual percentage breakdown rather than the strain name. And so from my experience, percentage breakdowns are the best way for me to reproduce your healing effect or reproduce your therapeutic effect, and to keep you with the quality of life or the expectations that you're looking for consistently from cannabis. And so as we become more sophisticated in our medical marijuana talk, we'll start to drift away from using strains or relying on strains as they don't really tell us much, and really focusing more on genetic plant makeup. What percentage of each terpene, what percentage of each cannabinoid, and even what percentage of each flavonoid is in the plant so that you can really get more accurate.
Awesome, that's a great answer. Thank you for that, Dr. Olga. Another question we have is wondering if you know what the latest findings are with cannabis and COVID-19. Is it being studied as a preventative or treatment option?
Oh, it absolutely is. There are a few studies involving specifically CBD. And we all know in the medical community, once you start opening a can of worms with one cannabinoid, the floodgates open up. So CBD is quite literally our educational, research, or evidence-based gateway cannabinoid. And so there are studies involving CBD and its immune boosting effects, especially early on in the viral replication stage, basically trying to see if CBD decreases the virus's ability to attach to cells, and also increases the sensitivity of certain fighter cells in our bodies so that they can recognize the virus earlier on. And so some of these studies are researching or trying to find the correlation between CBD and its ability to be, in effect, an antiviral. Also, its ability to boost the immune system in a healthful way, not in immune response way, but in a way where we can recognize things much faster and stop the spread much faster. I also know that CBG and CBN are being studied for their abilities to promote sleep, restorative sleep, and its correlation the correlation between restorative sleep and proper immune function. And then I also know of a study that is involved with the correlation between vitamin D levels and CBD and its effect on improving vitamin D levels, which are also important for blood flow and immune health. So yes, there are lots of studies.
Yeah, and I'm sure more emerging as well. Another question we have is, there's a difference between just CBD oil and then edibles with THC. So I guess, is there a difference between, it looks like they're asking, is there a difference between getting your over-the-counter CBD oil and then having something with THC in it?
Oh, that's an excellent question. Yes. So CBD oil generally is referring to oil that contains some content of CBD. Mm-hmm. So anywhere from full spectrum to isolate. When we're talking about over-the-counter CBD, we are talking about industrial hemp. So everything that contains, any CBD oil that contains THC will have less than 0.3%. So those are the over-the-counters. Now, when we're talking about edibles that contain THC, at this moment, edibles that contain THC can only contain less than 0.3% unless you have a prescription. So then again, we're referring to over-the-counter. If it contains more than 0.3%, it is by definition in the state of Texas not over-the-counter, either by prescription or it has to be black market. And so if we're talking about CBD oil containing products and it contains THC, we're talking about over-the-counter because it by law has to be less than 0.3%. Anything higher than that would be quite different because it would contain quite a bit more of THC.
Awesome, thank you. Can oil like this help with anxiety relief?
Oh, yes, that is the best question. I love this question because it tells me that the mind is expanding to accept something that traditionally was so villainized that it wasn't even on the radar. Anxiety is an excellent condition to address because it affects every body part, every organ system, and it is also triggered by disease in any organ system. For example, if you have chest pain and you're perceiving that there's pain there, most of us will develop anxiety. It is a natural physiologic response. Likewise, if you have anxiety, we also know that it can develop into disease, which means that the physiologic trigger can cause disease. Why that's significant is because we now have a plant that can affect anxiety as a symptom, meaning regardless if it is the trigger of disease or if it is triggered by the perception that you're diseased or triggered by the fact that you have one. And when you can affect a symptom that is this broad, it gives you an idea that the plant itself or the treatment option itself must also be broad. That means that it validates that cannabis is so effective in the human body simply by being helpful with this specific broad symptom, anxiety. So to answer your question, not only has our previous research that anxiety can be treated by controlling our endocannabinoids, we know that plant cannabinoids control our endocannabinoids. They can affect our endocannabinoids. And so therefore, even before cannabis was legal, we knew that this plant or any cannabinoids would be effective at treating specifically anxiety. This is a very, very, very well-known and long-known fact, not fiction, fact, just by studying our ECS.
We like facts.
Great question.
On top of that, and in discussion with the anti-anxiety, someone asked if cannabis can be used to assist, or as you call it, medical marijuana, can be used and assist in weaning off of benzodiazepines.
Absolutely. It is something now, I'm going to name a few substances that we really want to be careful when we're weaning. And there's many that go in this category, but benzodiazepines like Xanax, Ativan, Klonopin, opiates like morphine, codeine, hydrocodone, alcohol, and nicotine in extreme cases like pregnant women that are very addicted. Those withdrawals can be such a big deal that they can actually be deadly. And benzodiazepine withdrawal is one of them. And so it can be used to assist, depending on what you're using it for, to help you wean to a lower dose or off completely, but should always, always, always be done with the assistance of a trained, licensed professional, always. Just because the withdrawal from a benzodiazepine can be very dangerous.
Yeah, yes, again. So someone asked, and this goes back to dosing. I think dosing is a popular topic right now between people who use over-the-counter CBD and medical marijuana. For someone just starting out for chronic back pain, they're asking if 2 drops twice a day would be best. We obviously refer to physicians in that case.
I'm going to answer this in the setting of chronic back pain and sudden back pain. In the setting of chronic back pain, we have to understand that there is a reason why that pain is there. So it could be a bulging disc, it could be a previous accident, a cancer that's in the bone. There are different causes. But when it's chronic, we know that the cause is persistently there. So if there's anything that is persistent or long-term for me, 2 to 6, greater than 6 weeks of duration. Clinically, it's greater than 4 weeks. If it is chronic or persistent, then you need to have a persistent level of the treatment in this case, if you can't find the healing or curative solution. So that means generally you need to have this in your system throughout the day. Most people's pain is worse at night or after they're active. And so you need to expect to definitely have it in your system at a steady state when those triggers come up, but you also need to expect that pain is that complex and requires 24-hour resolution and not spot treatment. So I would usually tell my patients, if twice a day or every 12-hour dosing, if you notice your pain is wearing off at 13 hours, then twice a day will work. But if you notice your pain is coming back in 2 hours, then you may need to dose every 2 hours, realistically, or if you're noticing it's every 4 hours, and so on. Now for sudden or acute pain, this is different. This is not necessarily pain that's going to be there forever. And so generally, those pains can be treated with spot treatments. And so you may find that twice a day for the first 2 weeks is all you need, or you may find that once a day every other day is all you need. And in that case, 2 drops may be more than enough. In both scenarios, though, I want to make sure everyone understands what's 2 drops for one person may be 24 drops for another. So always be patient and plan on starting with your lowest dose, which, as I recommended, is usually 1 to 2 drops of a high concentration tincture, and then plan on increasing every 1 to 2 hours until you feel an effect. And so, like I said, some people it's 2 drops, some people it's half a bottle.
Yeah. All right. Well, I think we'll kind of go ahead and wrap up. One of the last questions that we had is, where do you want to see the medical cannabis program go in 2021?
Oh boy, if I could have, in my way, I want everybody to understand it's not me as Dr. Olga. This is from my experience with hundreds of patients, and really kind of understanding the wide spectrum of the breadth of the individual's perception of their own quality of life, which is where all medicine should be, okay? Now, I know that's idealistic, but because of my experience, with other patients. If I had my way, medical marijuana would be completely descheduled, because every physician and every physician should have options to the wide range of dosing possibilities. This should not ever follow the trends of anything like Tylenol or ibuprofen, where you see a dose and there's only 2 or 3 available doses for everyone. This should be something that is utilized in a genetically specific way, based on how the patient or the person using it would respond to that dose. What we know is that it's going to be a different percentage of THC for everyone. Some people need 2% THC, which is more than 0.3%, by the way. And some people need 70%. Some people are going to need to smoke the dried flower. Some people are going to, for their PTSD, for example, some people are going to need to only take suppositories and in very high quantities of THC, THCA, etc. So in my opinion, in order for this to be functional medicine for the individual, for us to get away from excluding inadvertently an entire percentage population of patients, it needs to be widely available and it needs to be widely utilized for practice abilities. Now, that does not mean that I have any opinion either way on recreational. But when it comes to medical marijuana, and I would argue most everyone is using it for that reason, even if it's social medicine, which is how you socialize, we need to have options that are widely available. It needs to be wide open. I do agree with regulation, but it needs to be available for the practitioner and for the patient.
Yeah, couldn't agree more. Thanks, Dr. Olga. We appreciate having you today on behalf of Compassionate Cultivation. Thank you for your time. Everyone watching and attending, we appreciate that as well. If you have any questions, visit us at www.texasoriginal.com. Thanks, Dr. Olga.
Thank you, guys.